Good afternoon, everyone. Welcome back to the Peoria City County Health Department for today's informational. Today is April 30th, 2020. I'm Andrew Rand. I'm going to get this right this time. I'm chairman of the Peoria County Board, not the City County Health Department. On behalf of Mayor Artis, Chairman Krug from Woodford, and Chairman Zimmerman from Tazewell, thank you for being here again. Today happens to be National Teacher Appreciation Day. I don't know if we're doing it for the day or the whole week, but all of us know that our teachers have been put to the test, along with the rest, to provide our kids access to alternative means to get the job done. And all of us who know teachers and all of us who love teachers should certainly give a shout out to anyone you know in that business. And thank you to all the teachers, and it is my understanding it's a week-long celebration. Well, since we had a chance to visit last week, the numbers continue to tell a different story in Illinois, and it requires a different kind of interpretation, and Monica Hendrickson is here to help us understand that. I also know that there are different stories being told about the degree to which we should cooperate with the governor's request of all of us, and certainly here in Peoria County, as the chairman of the county board and our mayor, we're all going to continue to cooperate and find a path forward to help our state reopen, doing it the right way. And I understand the many people who are upset and really, quite frankly, flattened with respect to their businesses or their incomes as a result of this. It's extremely painful. I talk to people almost every day about it. But I don't think going blindly into the storm without a plan is a very, very good idea. And I have to support all the officials that are giving us information on the spread, containment, and means of this contagion and our understanding of it evolving constantly. And science is not lame in any way. Science is real, and I think that the passion that people have that is unabated by best practice advice is a weak form of a justification. So I want to commend all of our community members and organizations, and certainly our citizens and taxpayers who are doing their level best to put up with this situation. There are efforts made every day to find a path forward, and I sure hope to be part of those announcements in the weeks ahead when we get some light. So until then, thank you for being here and helping us get this information out. Please shelter in place. Please protect yourself. Please remember PPE. And decisions without science is really lame. So let me bring our scientist up, our epidemiologist, the director of the health department, Monica.
Thank you, Chairman Rand, and likewise want to acknowledge that it is Teacher Appreciation Week, and so we do recognize the great work our teachers do, as well as our educators as a whole, in this really difficult time. And so, again, echoing what the chairman says, reaching out to them and just thanking them for what they have been able to do in this response time period. To report for this, for today, May 4th, currently we have no new cases in the Tri-County region. So the numbers sit at 108 for Peoria, 45 for Tazewell, and 13 for Woodford, making a to-date total of 166 cases. I would strongly advise, though, do not misinterpret this. This is actually a type of timing of reporting. We did get an additional batch of test results that we do know there are positives later this afternoon, and so this number will change drastically tomorrow. But again, as of today, we have no new cases reporting when the numbers were released. And also in regards to deaths, we have no new deaths to report for the Tri-County region. So with Peoria, Tazewell, and Woodford, we currently sit at 7 deaths to date. Last Thursday, there was a request in terms of information about understanding the status within the Tri-County. Peoria County, Woodford County, and Woodford County data are available on our respective websites as well as our social media. But for the Tri-County as a whole, 56% of our Tri-County cases are considered recovered. 30% of the Tri-County cases are at home and isolating, and 9% of Tri-County cases are currently hospitalized. To give perspective, we get daily reports for a 17-county region in Illinois, of which currently 40% are at home isolating. So relatively speaking, our region is pretty much aligned with what we're seeing for the larger 17-county area. Additionally, in that 17-county area, the 7-day average of cases still continues to increase steadily. About a case a day is our average. So right now we're sitting at about a 39 daily average increase for this 17-county region. And that 17-county region goes as far north as LaSalle, as well as down to Peoria and to some of our southern neighbors, and then over to McLean County, as well as to the river on the west as well. In addition, Heartland Health Services completed 101 tests between Saturday and Sunday. We will have additional test information for today's totals later in this afternoon as part of the press release from our PIO network. From the hospital systems, there are 17 individuals that are currently in the ICU, 7 of which are people under investigation, and 10 are confirmed cases of COVID. Non-ICU bed is at 27. So again, since reporting here in the beginning of April, we see that the fluctuation in our areas tends to still be between that 40 to 60 range in terms of total bed usage between ICU and non-ICU beds. As Chairman Rand alluded to, there was a lot of discussion about businesses and what it means in terms of the executive order. And one of the areas that we did want to focus on today was understanding around food establishments, specifically in Peoria County. So with that, I'd like to introduce Carey Panier. She's the Director of Environmental Health here at Peoria City County Health Department.
Thank you, Monica. Good afternoon. Thank you for the opportunity to be here today. I also want to thank my environmental health staff as well as the other department staff and the leadership here at the health department. It's been a great group of people to work with during these crazy times. I'd like to take a minute to remind everyone that currently there's no on-site consumption for bars and restaurants. It's currently only carry-out, delivery, and curbside. Just want to reiterate that and make sure, because there was some confusion on that, that still stands, that there's no on-site consumption in Peoria County for food establishments or bars. Throughout the last few months, the environmental health team has collaborated with the Tri-County health departments as well as the Peoria region for working on different documents and guidance and different ways of how are we going to go about working through these times. For health department specifics pertaining to your county, please contact that county's health department. For example, if you are in East Peoria or Pekin, that would be Tazewell County. If you are in Eureka, that would be Woodford County. Peoria, Bartonville, Brimfield, Princeville, those areas are within Peoria County, and we would be happy to answer any questions that you might have pertaining to the cities and towns in Peoria County. Additionally, we've been working with the City of Peoria on various issues and topics, anything from porta potties and how often they should be cleaned to guidance for farmers markets for when they are able to resume operations. I look forward to working with the city as well as the other local health departments as we navigate these waters together. Although the environmental health staff haven't been doing what I would say their normal duties and activities the last couple of months, they still have been hard at work, either being innovative for how are we going to work through conducting food inspections, whether it be virtually or when we do get to go back on site. So we've worked on different guidance documents. whether it be for staff pertaining to how they can safely perform field activities, screening our clients, so when we do have on-site meetings with them, whether that be at a food establishment or a well or septic site, then we have procedures in place to do things as safely as possible. One of the big things that we've done the last month and a half is our staff have developed an online self-inspection tool. So we've been encouraging any food establishment in Peoria County who is currently operating to submit a self-inspection form every couple of weeks. We review those, we follow up with them. It's basically a learning and education tool to help them work through these times and try to maintain food safety. Additionally, establishments that are currently not operating, when we do know a time frame when those places will start operating, we've asked them to also submit a self-inspection form closer to that time of resuming operation. As I said, we're researching virtual inspections or some means of touching base with a food establishment that helps us when we can't physically be on site. So that might be using some sort of social media tool or video call or something of that nature, as well as possibly even just a phone call to check in to see how they're doing, how can we be of assistance. You know, are you doing things outside of your normal capacity so that you could do curbside carry out and delivery? How can we help you perform those duties and still do it in a safe manner? And then as we transition to when things can go back to, I don't know if we can ever say normal, but when things are phased in and then on-site consumption can resume, thinking about how that will look, because it will not look the way it did prior to stay-at-home and curbside delivery and carry-out. For example, in other we're doing some research on this. For example, in other states, they may be operating, their food establishments may have to operate at a lower capacity than what they were normally doing. So this might mean being strategic about placement of tables and chairs, number of people that can be inside of an establishment at any given time. So just different things that we are cognizant of, and we're doing some research to put together some guidance for when that does happen. Additionally, the Peoria City County Health Department environmental health staff have resumed conducting final inspections for wells and septic systems, as well as final inspections for food establishments that are new that had approved plans to that submitted their plans to us that we have reviewed and approved. For more information and any of the guidance we've developed, as well as our self-inspection form, please visit pcchd.org. At the top, there's a red COVID button, and to the right of that, if you click on the Read More in red, that will get you to some of the other guidance and documents, not just for environmental health, but for the health department as a whole. With that, any questions for me?
So this may seem like a silly question, but with self-inspection, how can you make sure that people aren't lying or stretching the truth? Because food safety is obviously really important.
Sure, very good question. Initially, we rolled out a paper self-inspection form, and we very quickly realized that people were just filling in compliance for everything. And so then we realized that wasn't a very good way to assess what's actually happening, or some people were answering questions that maybe didn't pertain to them. So it's another opportunity for us to educate food establishments on food safety. One of our staff came up with the idea of using our red cap system, which is also the system we have our foodborne illness survey report in as well, to be more interactive. So that's when the online self-inspection was developed. There It doesn't guarantee that people aren't going to click everything yes, but if they were to click something no, then it also provides educational handouts and information. And we do have staff reviewing those and following up with the establishments if we have questions, or, hey, you marked that you're in compliance with your shell stock tags and you don't do seafood. So different things like that. So it has been challenging, but we are working with establishments the best we can to provide them with an outlet and someone to help them through with food safety.
And so is this something where you see that virtual kind of method that you talked about, maybe like a FaceTime call showing things would become more prevalent, or are we thinking more this kind of online survey method?
Well, what we're researching now, and which I'm very excited about, is using some of that technology that's out there, not forever, but to get us through COVID times. What we have been talking about is walking through different questions with that person in charge that we are able to, even if it's just on the phone, but ideally if we can do it with a video component to that, then we can literally walk around the establishment with them. Maybe they can show us how they're taking some temperatures, or maybe their sanitizer concentration, different things of that nature. So trying to be a little more hands-on without physically being there. Any other questions? No? Thank you.
Are there any additional questions for me?
Are you worried that there's going to be a spike of cases in the TriCounty area after East Peoria's mayor said you all can go ahead and open up businesses if you want to, certain businesses? And not only the fact that it's open in East Peoria, but now people who can't go to the nail shop or hair salons or barber shops here in Peoria County may just go and travel over to East Peoria and bring whatever they got over there back here. So I just wonder what you thought about that.
So I think the question is, with the possible early relaxations of policies in our neighboring communities, the possible impacts we might see here locally. I don't think it's actually just even locally here in Peoria. I think this is a tri-county system, is the fact that I think there is concern that when we relax something too early, the ability to see increases in cases happen. One of the key things we have to always recognize about this virus is that it is very contagious. Again, one individual can pass it on to 6 other individuals. And so here locally in Peoria, and I can only speak to Peoria, is that I really am always happy and proud of the fact that, as the Chairman Rand spoke about it, and even Mayor Artis the week before, is that we really are wanting to use data to drive this measurement. And so our hospital systems, looking at what their data points are, looking at our capacity, I think we're going to keep monitoring that. We have been, and we've set up a system to monitor it continuously, but we are going to be really watchful of it to understand that these changes and what does it mean. The thing to also recognize is that the incubation period we talked about, right? So if a person gets sick or been exposed, it's up to 14 days when they can start developing symptoms or start transmitting it to others. And so this might happen, these kind of changes happen this week, right? But now the question is, we might not see that actual impact of it tomorrow. We have to be, again, using the science and recognizing that incubation period. We're going to be looking at 14 days out and even further to make sure we recognize how this has impacted our system. So we are monitoring it. We're monitoring it and understanding that the timeline is really going to be dictated by the virus, and we're just going to keep an eye on it. But everyone's been alerted, and I think that's the best we can do, is just be fully aware, educate the public that while these relaxations might be happening in different agencies, your personal hygiene, your ability to socially distance, wear masks, those are really important. And then again, reiterate something that the mayor spoke about in East Peoria, which is that businesses need to be mindful of whether or not they choose to open or not. If they are regulated by the state, if they have different funding sources, depending on how they move forward, they might be jeopardizing themselves. So again, just being cognizant of that, it's not necessarily an easy move to just reopen. There's a lot of moving pieces and a lot of data and science we need to watch for.
So as a health leader, would you recommend to neighbors not to go into these businesses, or would you just say, do what you want to do, but take precautions?
I think as a health leader, I'm going to start off by saying that the executive order currently stands. We've seen increases in our cases. Now, a lot of people like to say, hey, but it's not that drastic, so we're doing great. But we're doing great because the interventions have been working. So let's continue to do the good work. So my focus is going to be the executive order of stay at home is there. Our hospitals are within their capacity. So right now, we are in a great place. Again, wanting to make sure we don't necessarily ruin this as we go along or open up too quickly. On the other side is, I think, not just for this case, but in general, when we talk about the self-awareness. I think the question was, do we tell people, hey, it's on your own risk? People need to be cognizant. I mean, we educate the best we can that right now the stay-at-home order still exists. Again, practice those principles as much as possible. But this is not just for this, but I think general public health in general, we do talk about an individual's risk, understanding their own risk. We talk about helmet laws. We talk about seatbelt laws. We talk about vaccinations. We talk about it in terms of healthy foods and diet. So I think there is a balancing act of understanding that if people choose not to stay at home and feel that they can now go out there, then I'm just going to strongly encourage the fact that do your best to protect yourself and those around you as much as possible. But again, reiterating the fact that the stay-at-home order is currently in play.
So one thing that we've talked about several times over the last several weeks we've all been meeting here is the need for antibody testing, not just that point body testing, but that antibody testing to see if you've already contracted the virus and if you've built up some kind of immunity to it that may allow you to get back to some semblance of normal life. So with the FDA today coming out and basically telling all the companies selling these antibody products, some of which are of questionable reliability, you need to provide data that shows your product works or you need to pull it off the market. What's that mean to you as a health department, a county health department, in terms of maybe making these more reliable and making this a more accurate metric for your usage?
So the question is about antibody testing and how it is one of the surveillance tools that, as we try to get back to normalcy, is key to have, but at the same time, the new guidance from the FDA saying it's time to show us the data. That we've given you kind of a leeway during this emergency use, now it's time to have the data. And we discussed this previously about the fact that's exactly why it's been really nerve-wracking about individuals saying, hey, I have antibody testing, come and get tested, because the data wasn't out there. It was either giving out the impression that it was going to answer those questions of, have you been exposed, yes or no, and are you now immune, yes or no. And right now, the data doesn't suggest that these tests are able to do that. Partly because, again, COVID-19 is part of a broader type of virus called coronavirus, which is common in our communities as a whole. So a lot of the serology testing or the antibody testing was not necessarily telling us specifically about COVID-19, but just about coronaviruses in general. So I applaud what the FDA is doing, because they're really gearing up into the fact of what we expect from our FDA, expect from our when we hear that something is approved, that it means that it's been through that process, highly vetted. Likewise, we really do want to have a strong serology test, because in the absence of a vaccine, that's the best understanding that we're going to have of herd immunity, really. We're talking about flattening the curve, and this is really about making people stay within the capacity of the healthcare system, so really dragging on how many people get exposed over time. So really, herd immunity is going to get built up slowly if we do it right. So with that in mind, as well as the fact that we don't have a vaccine, serology was always going to be one of those surveillance points that we need. And so if we can get a strong test and a strong indicator, and there's a lot of research going out there, a lot of our hospital systems have signed up to help test and facilitate some of the testing, not meaning that it's given to necessarily to a patient to say yes or no, but just from an academic standpoint. That's a really needed tool to have in our arsenal.
So just a follow-up that I'm aware of at least one Peoria area business, and I'm sure there's more that are currently selling some form of antibody testing, and they, some of the manufacturers are well-known companies like Abbott Laboratories, some are less known and less reputable, but the testing can be on the expensive side. It can be $100, $200 per test. Is it recommended to go through this testing at this time? Is there still major questions about reliability? I guess that would be where I would go with that.
So the question is about the serology or the antibody testing, and whether or not people should maybe go after that. It's a private test. I mean, it's about roughly, I've seen the price range between $150 to $200 a person. So to the first part, recognizing the fact that when the FDA approved or gave usage rights to some companies, there's two categories that they gave it for antibody testing. One was what they called emergency use, which they said, hey, we have a product for testing antibodies. We have to go through some kind of criteria aspects about it, but the FDA says we can go ahead with this, understand that it's very limited. The other approval that the FDA gave was one that was kind of like, hey, we're gonna approve you, but in doing so, you have to be in these high level labs, as well as recognize the fact that once we give you usage, we're gonna one day ask back for that data. So you better be ready to prove that data, which is that today is where we're at right now. So in both mechanisms or both kind of scenarios, no test was approved, fully approved, and gone through the full FDA vetting system. So I would say it's a little bit of recognizing the fact that know what you're about to buy. You know, if you want to spend $150 to $200 for a test that will not tell you positivity that you had the virus before and you are immune, is that something that you want to invest $150 to $200 in? Likewise, I think we should also recognize the fact that not everyone in our communities can afford $200 worth of testing. And so again, really be aware of what you're about to purchase in those scenarios.
Some stores in around the TriCounty area are not allowing customers to come in if they don't have a mask. Some customers are angry because of this, and also saying they don't have a mask, nor do they know where to get one. So do you think that the stores are in the right? Do you think that the customers have a right to be upset? And if not, can you tell them where they can find masks?
So the question is about masking when you enter a business, and part of the executive order requires individuals to have masks when they go into businesses. And so I strongly feel that your businesses have every authority. They have the authority, no shirt, no shoes, no service. Again, they've had this authority before and in the past, so I think it's an extension of it. For those individuals that don't have accessibility to a mask, one of the great services we have in our community is 211. 211 has the ability to connect people with resources, and so again, I'd highly recommend that they utilize the 211 services to get connected with masks.
Monica, when we started testing in the Peoria area, you said it would take a couple weeks to start to get an idea of what parts of our community were taking advantage of that. And part of the reasoning behind placing them where they are was to specifically advantage, some of our, either lower economic communities, minority communities, et cetera. Are we seeing those populations using these testing sites?
So the question is, now that we have tests now 2 weeks in, are we seeing those vulnerable populations we discussed utilizing it? And I think the data on our website suggests that we are. We're seeing certain zip codes, the placement of them, we're seeing that uptake of it, as well as our long-term care facilities. We've seen a lot of staff utilize the service as well. So that high-risk population that we were targeting, we are seeing them utilize it. And I think it strongly indicates the fact that about a quarter of the positives that the health department here in Peoria is finding from testing is coming from Heartland Health Services. So I think those tests are doing exactly what they were meant to do, which is get a better understanding of community levels of this virus. And so I think the tests are doing a great job. I do want to go back to a comment, though, about the face mask. The other thing to make focus is not it has to be a mask. It just has to be a face covering. So if you have a scarf, a T-shirt sleeve, a lot of people are cutting up T-shirt sleeves and covering it. Those also qualify as a face covering. It doesn't necessarily have to be an N95 mask. And so, again, wanting to focus on the fact that masks are not just what was required as face coverings in general.
Are they as effective?
In this scenario, when the question is, are they effective? Face coverings, the best way to say is that you're trying to create layers of exposure for yourself and others. And so if more people are wearing masks, if you are contagious or you're asymptomatic, you're not sharing your germs, so to speak, as much. Likewise, if you're wearing one, you're creating that additional layer. 6 feet distance is going to always be your best friend as well. So in lieu of not having a face mask readily available, if you're able to keep that 6 foot distance, that's also going to be a good indicator. But remember, part of the executive order is face coverings in businesses.
Monica, as an epidemiologist, when we see, as you said, over half of the cases in the Tri-County area are considered recovered, what is your interpretation of that, and what should people either not make assumptions about it or assume about that number?
So I think the question is, now that we have our Tri-County is seeing about half of our confirmed cases be recovered, I think what it tells us is, one, that majority of individuals will recover from this virus, which is a good thing. But I think what we are still waiting to understand more from a global side is, once I have been recovered from this virus, can I get ill again? And that's still a question mark. We're still learning more about it. And that's why we want to continue to keep the good work that we're doing to kind of slow the transmission of this virus. So.
Can you explain why we didn't get test results today? I know people are going to be wondering about that.
So the question is why we didn't get test results today. It was a timing aspect. We ask agencies to submit their data at 11:30 in the morning so that we can get it from all the various sources. We had a batch of results that came in afterwards.
So it's just a timing glitch, and we're going to get 2 days results tomorrow.
Possibly, yeah.
Okay. And then over the weekend, we had some big crowds form on the, I think, on the south side in relation to some of these shootings there. And you know, some of my editors asked, what message have you gotten out to these communities that this is, you know, just not a good idea to have 200 people forming in a crowd like that?
I think the messaging that we've been giving out is just general public messaging about the importance of gatherings. I think the event that you are speaking to that happened this weekend in the city of Peoria, that's more of a law enforcement question, and so I would direct you to the police department or the sheriff's department for further understanding of that. Okay. Well, thank you guys. Have a good day.